Dr. Sherman Silber, welcome to the podcast. Dr. Sherman Silber is a pioneering leader in reproductive microsurgery and IVF, in vitro fertilization, and the director of the Silber Infertility Center of St. Louis. Widely regarded as one of the world's top infertility authorities, his work spans IVF, mini IVF, ICSI and advanced sperm retrieval, vasectomy and tubal ligation reversals, egg and embryonic freezing, and breakthrough techniques in ovary transplantation and ovarian longevity. His contributions to modern fertility care earned him recognition as one of the giants in reproductive medicine and the 6th IVF Worldwide Online Congress. Doctor, my first question to you is, what brought you down this path? If you were to go back to your early days when you first started, what inspired you to head down the path of IVF?
Interestingly, I never, ever would have been planning to do this. My mother told me when I was 5 years old I should be a doctor. So I actually wanted to be a English professor, but I decided I better listen to my mother.
Your
So
Jewish mother, I assume.
a Jewish mother, very Jewish mother. And so I went into medicine and I actually found it fascinating. So although I really would have preferred to have been teaching English and American literature. I love medical school, and but then I decided my father told me I should be a surgeon, so I figured I better be a surgeon. But I never dreamed. I just have decided that after my long career so far, that you can't really make a 20 or a 30 or a 40-year plan. You can make maybe a 5-year plan and do what really seems interesting and fascinating. And luckily, I found medical school absolutely fascinating. It was hard work and long hours, but I couldn't get enough of it. But you just follow what you love at the moment. And then 5 years later, I'm guessing 5 years, there'll be another tributary in that river that'll be really fascinating. And you take that fascinating tributary. And then 5 years later, there's going to be some other possibilities, but you take the one that is you're most enthusiastic and excited about. And then it's like Steve Jobs said in his famous Stanford speech. Then suddenly 20 or 25 years later, you connect the dots later. So what happened was I was in the public health service in Alaska right after my internship training, and I was up there taking care of urology patients and surgery patients, and there were no specialists to help me. I was a general medical officer. So I found it very interesting. And there was one patient that was fascinating. His name was Arctic Johnny up in Alaska, and he was renowned as the greatest wolf hunter of all the Eskimos in Alaska. But he was 84 years old and he couldn't hunt wolves anymore because he had to pee all the time and he had a prostate problem. So they sent him down to the public health service hospital, and he was the most grateful patient I ever took care of. Took out his prostate gland, and he went back up to Anaktuvik Pass in northern Alaska and continued being the greatest wolf hunter because now he didn't have to stop and pee every few minutes. So it's just silly events like that that you think would have no impact on your life made me decide to go into urology. So I came back from Alaska, did a urology residency at University of Michigan, where I'd also gone to medical school. And I found that the only thing I really liked about urology was kidney transplantation. So
Mm.
I got into vascular surgery, kidney transplantation, and I was just struck and fascinated by why, when you take out one kidney, does the other kidney grow and do the work of two kidneys? Compensatory hypertrophy, it's called. Why should that be? And what would happen if you put extra kidneys into someone? So the only animal I could do that on that was sufficiently inbred was the rat. And so I developed the whole field of microsurgery for surgery training, putting together little tiny invisible blood vessels by doing kidney transplants and heart transplants and liver transplants in rats. And my mother said, how are you going to make any money doing that? I said, well, I haven't really thought about that, but it's a fascinating question and I really want to know the answer. So we found out that when you put extra kidneys into rats, they have extra kidney function. They have 2 or 3 times normal kidney function.
Mm.
They don't get smaller. And that was interesting to me, and it was published in the American Journal of Physiology. But what was most interesting about it was the microsurgery. I developed this whole field of microsurgery in order to answer this silly question. And I became famous for that. And when I came back, I was the youngest chairman of urology at the University of California, San Francisco. I was just 31 years old and the chief. And it was just because of this research. And I said to my wife, I could use this microsurgery to do vasectomy reversals, but no one would be very interested in that because people have their vasectomy because they want it to be permanent. And she said, well, you better rethink that. I think men do want to have it reversed, and you better figure that out. So I published a paper on reversing vasectomy that was extremely successful using microsurgery. And the next day I was on the front page of the New York Times. And that was October 15th, 2075. And so, but that they didn't have an internet then, but we had the AP. So I wound up being the front page of almost every newspaper in the world. And I was flocked and overwhelmed with vasectomy reversal patients. So I figured I better learn something about the rest of infertility. Now, when I was a urology resident and we rotated through infertility and we had to do sperm counts, I couldn't stand it. I couldn't stand it even being in the room because sperm to me smelled just so awful. And I never dreamed that I was going to go into urologic infertility. But that's what happened. And even now, I make sure in the IVF lab that all the sperm samples are washed and cleaned by the embryologist before I go into the lab. So you can't predict the future, but
Man plans and God laughs.
just can't predict it. But connecting the dots later, I became like a world renowned infertility pioneer. And I never dreamed that was going to happen. That was the one thing I was sure I wasn't going to do.
Yeah.
That you asked the question, it's a long answer, but I
That's
think,
a great one. It's a great one.
you know,
Yeah, it's always easy to connect the dots looking backwards, but it's impossible to connect the dots looking forward.
you fool yourself if you think you're going to follow a path that no longer remains interesting. You have to keep on doing what's fascinating.
Right. Right. And you got to make the most out of every moment and every task, even if when you're doing them, you don't necessarily see the use case for it. Just understand that the better you do the tasks in front of you, the more you'll have options and the more you can leverage that knowledge in ways that you didn't anticipate when, you had to do it.
I think
So,
that's really, really well said. That's exactly right. And that was the message Steve Jobs was giving at his Stanford graduation speech.
yeah,
Uh, just Just do as good a job as you can and do what you're fascinated with. And later, you'll just be amazed and you won't be able to predict what it's going to lead to.
I have so many questions. So first, I want to talk about IVF for just a moment.
Okay.
In vitro fertilization. I want to know how this industry has progressed when you first started it, because I was just talking to someone the other day about longevity science. And what I said there was, we have evolved to see the beauty in death. We have evolved to see the beauty in aging. We say that our finite time on this world gives us value. It makes us cherish the time we spend with our people. It makes us be careful who we choose to marry and spend our life with. It makes us value the time with our parents because we know that life will take them away from us. And one of the best coping mechanisms we've used through evolution to cope with death is to pass on our genes. That is one of the most effective ways for us to live on. Another way would be, the reason why we talk about Albert Einstein every day, right? He's made huge contributions to human life, and it's why he passed on his life in the minds of everyone else, and it's why we don't know who Albert Einstein's neighbor was. Where I'm going with this is pretty simple. IVF, people having infertility, it's not just like a clinical diagnosis. It pulls at the heartstrings of your own existence. It's almost like you're blind to some capacity. And I can only imagine how this field has evolved in the past few years. So I want to first probe your perspective on the underlying philosophy of infertility, and then I want you to explain to me how this industry has evolved through modern science.
Well, there are two separate questions. And uh, absolutely right. When I see young women in their early 20s that suddenly have a leukemia or Hodgkin's disease and they need a bone marrow transplant. They're not really worried that they're going to not survive. They figure they'll survive because everybody 20 is going to survive, and at least they think that. And also, cancer treatment has become so spectacular for these cancers that used to kill young women. But what makes them cry is their infertility. They know that this bone marrow transplant that's going to save their life is going to make them sterile and they won't have to be able to have children. That's what emotionally gets them.
Mhm.
And it's always universal. So, we pioneered freezing ovaries or the ovary tissue so that we can then transplant it back 15 or 20 years later, or whenever they're cured of their cancer and they want children. So I get to see a lot of these cancer patients. The cancer is just something they know they're going to deal with and it's going to be okay. The fertility is what really,
Mm.
really bothers them. Will they be able to have children? So you're right about that. And I found there are many people that say, well, I don't want to have children because they interfere with my lifestyle. And that's okay. I mean, I like to do this, I like to do that, and children are just going to get in the way, and I'm just not into it. I can tell you that most of them at 50 are coming to us and they want to have children. They and when they're 60, if they don't have children, they get very depressed. And
Why do
so
you think that is?
I think it's intrinsic. It's just
Mm.
everybody dreams of immortality, and they want to transfer themselves in some way into the next generation.
Yeah.
Uh,
And
I-
and life has the
very intrinsic.
funniest way of taking away the stuff we want when we finally want it.
Yeah,
Like, when we're young, we're hungry, we see the world ahead of us. We think everything is full of opportunity. We're distracted by the endless flow of pleasures that have nothing but immediate gratification. And as
right.
you kind of stumble your way forward in life, you start to realize that there's only very few things that actually matter.
Yeah,
And the time we come to realize that, it's just like life punishes us, that it's sometimes too late to make a family. It's about spending time with the people you love. These are things that you can never see until it's too late. So you've
Right.
argued that the reproductive biological clock is more modifiable than we think. So there's a silver lining here.
Right.
What do we understand? What do we misunderstand about why fertility declines with age?
Well, two things happen in the wo it doesn't happen in the man. The testicles have spermatogenic stem cells, and, Strom Thurmond became a father when he was an 84-year-old senator, and in fact, in the Senate, he was a senator from, South Carolina, and I know from talking to senators that they used to call Strom Thurmond, Sperm Thurmond. They would call him Mr. Senator Sperm, they would call him. They joke around because he had a baby when he was 84. But it's just an example that men have spermatogenic stem cells, so the biological clock doesn't affect the male. However, the male isn't as intense as the female is about the child. He wants a child for sure, but the real motor tends to be the woman. Now, she has all the eggs she's ever going to have when she's born. And it's an interesting design. Spermatogenic stem cells in the male mean that the cells that will become sperm are constantly dividing for one's whole life. And that means there's going to be more mutations. And in fact, most of the mutations that lead to evolution come from the testicle, not from the ovary. So without these mutations, some of which are deleterious and some of which are beneficial, there would be no mutations. We wouldn't have developed from the lowly flatworm
Variation
to
in
primate
the evolution chain.
variation. However, you want to stabilize the species. And so the design is amazing with the woman as a fetus, the cell that becomes the oocyte, the egg, immediately enters a process we call meiosis. Now, that's where you have the reduction division of the chromosomes, which eventually leads to an egg and a sperm, depending on whether it's a male or female. And she goes into meiosis immediately, and that's all going to be over in 20 days. And then it's either going to be an egg that's fertilized or it's going to die. And so, if it were to some way of arresting it in meiosis, then the female would be born with no eggs because she doesn't have stem cells. So what happens is when the early eggs in that 6-week-old fetus enter the ovary, they enter this very tough tissue that represents the outer membrane of the ovary, the outer shell. It's the toughest tissue in the body. Embryologically, it's the same as the tunica albuginea of the male. That is, the same tough tissue that holds our testicle together and protects our testicle, embryologically, is the tissue that becomes the cortex of the ovary in the little female at 6 weeks of fetal life. This tissue is so tight that it puts pressure on those oocytes that have started, those eggs that have started to develop. That tissue pressure causes the nuclei to rotate, and it causes a gene called FOX3 to go intranuclear. But what's more impressive is the rotation of those nuclei. The other cells aren't rotating, and they're arrested. These eggs do not go through meiosis. They are arrested in meiosis by that pressure. And through the female's whole life until she's average age of 51, it's the pressure gradient in her ovary that allows 30 of these eggs a day or 1,000 a month to be recruited and eventually develop and either be ovulated and fertilized or die. But it's a pressure gradient that keeps her from being completely out of it. Now, this rotation of the nuclei occurs in all of the stem cells in our body. You have stem cells for your skin and for your GI tract and for your liver and your heart. We have stem cells. And the stem cells have to be very slowly dividing, or they'd make mutations like in the sperm. And so you would have a shorter duration of life. But if those stem cells are very slowly dividing, you'll live longer because they are our hard drive. And we want to keep them from dividing. We want to keep them there as the hard drive. So exercise and tension in your muscles helps that. And the best example that is very colorful I'll give you is elephants. Any zookeeper will tell you that in the wild, elephants live about 60 years. But in captivity, in the zoos, they live only 40 years. Now, almost all other animals in zoos live longer than they would in the wild. They're protected, they get medical care, they don't have to fight other predators, they don't have to, I mean, they really have an easy life. Uh, but for elephants, it's different. And the reason it's different is elephants in the wild walk and walk and walk 50 to 100 miles every day because these 12,000-pound animals just, they eat wood and leaves. That's what they live on, wood and leaves. They knock down trees and they just would destroy the ecology of where they live. Before you know it, they'd have nothing to eat. So they preserve their food supply by eating and walking 50 to 100 miles every day. In the zoo, they can't do that. In the zoo, they're fed, they're taken good care of, but they don't get exercise. And that's why elephants live 20 years longer in the wild than they do in zoos.
Right.
So we know that longevity of an ovary is related to rotation of the nuclei caused by tissue pressure.
Fascinating stuff. Yeah, and just to I want to put a pin in this because yes, I want to talk about those telomeres and telomerase and those cell
Okay.
process, but I want to take a step back for just a moment, and I want to talk about from a macro perspective the progress of the industry of itself. And IVF of a particular fascination. When you first got in the industry, what was it like? What was the technology like? What were the hurdles being faced? And if you were to fast forward to today, how has that changed?
Well, we didn't call it an industry. That's the most important thing. It was science. And I think the industrialization, commercialization is really hurting IVF. And there are a lot of centers that really are not doing a great job. And because the, the private equity, they really don't have any, they don't have a vision of quality. They just want to
Isn't it
sell.
more of like medical protocols are missing in this industry? I've been doing some reading online, and like there's throughout clinic to clinic, there's just a wide degree of variation in terms of quality of output. And that's because one of the issues in the industry aren't that there aren't clear protocols and regulations to keep things consistent.
Well, let me, I'll answer it. As far as the laboratory work is concerned, and the embryologists, the College of American Pathologists do reviews and certifications every 2 years. And I can say that most of the labs have benefited tremendously for this because the object of these reviews are not political and they're not economical, they're not commercialization. It's really colleagues trying to improve colleagues, and you're really required as a lab director to actually do these reviews assigned by the College of American Pathologists, and it is really a great system. So the laboratories are, I think, are for the most part very consistent. What isn't consistent is the clinical, let's face it, the doctors, the clinicians are the ones in charge, and they tell the laboratory what they want to do, and that's very, very, very money oriented. It's really, really money oriented, and the quality is of care is really fluctuating, like you say. There are many, many different protocols. Now, we base everything we do on science, and we work on the whole science of converting skin biopsy cells to stem cells, and then stem cells to eggs, and then eggs to competent eggs that can become babies. And it's worked just great in the mouse, baby mouse that came from skin cells in mothers whose ovaries had been removed. Uh, and we're about to succeed with the rhinoceros, as a matter of fact, that has gone extinct in the wild, the northern white rhinoceros. And
Are you talking about resurrection biology?
yeah, I am talking about that. But we need those
Wow.
stem cells, but that's a little different. George Church, who's a genius at Harvard, what he's really doing is taking elephant genome and using CRISPR to put some genes in that we know from paleontology that these genes
Yeah.
were in the mammoth. So he's really
The
going to
woolly
make
mammoth. Yeah,
elephant,
the
mammoth.
thylacine and the woolly mammoth are the 2 in, like, discussion. The thylacine, the Tasmanian tiger went extinct in, like, the
Yeah, so
'30s.
you can make a modern tiger that has characteristics of a saber-toothed tiger. You can make a elephant that has some mammoth-like characteristics, but it's not going to really be a mammoth, and it's not going to really be a saber-toothed tiger. It'll be an interesting, fascinating animal. But so resurrection of an extinct species is different from preserving a species that is not extinct yet. So we have skin cells from rhinoceros, northern white rhinoceros, before they became extinct, and we can convert those skin cells into eggs, and we've had sperm frozen for them for a long time, and so we can actually. Uh, make those embryos because we got the living biologic material, not oocytes or eggs, but just a skin biopsy before they actually were all dead. So I think if we run a skin bank for all the species on the planet, just like Noah's Ark, we will, no matter whether they go extinct or not, we'll be able to resurrect them. Interesting, huh?
Yes, but can I pull this to resurrection biology for just a moment? Because y they are finding even, like, perfectly preserved frozen tissues with even, like, somewhat cell structure intact with the woolly mammoth, because they went extinct in really cold regions, and some of them just happen to be perfectly frozen and preserved. What's the challenges there with, like, reverse engineering and, like, when they put it in a relative species as the surrogate, why is it not gonna be an exact like a woolly mammoth? And even then, should we de-extinct the species, how would it make sense to, like, inject it back in this perfect equilibrium of evolution like the wild, right? Think of, like, putting
It's a
think
very deep question because there's a reason the woolly mammoth went extinct, and maybe if we
yes.
get back to life, it sounds fascinating, but maybe they won't do so well. especially in a warming world that we live in right now. They might not make it anymore. So you bring up a huge criticism that's, I think, really valid. But understand what I was trying to say is that the cells that are preserved are not fully preserved, and so you can find some DNA in their genome that is different from the elephant's genome, and you
Right.
can assume that those are genes that are in the woolly mammoth, but not in the elephant, and you can insert those genes
But
into.
doctor, sorry to interrupt you. Just one quick question. How do we know what genes are like the base structure of the species and what gene is a natural part of its variation? So, like, there is no one specific genome that maps to a specific species. So, like, at what point can you say that there's enough structure intact for, if this genome were to execute itself and produce an offspring, like it would be considered part of that species branch? Is my question clear? I apologize if it's
It is,
not.
but I don't know if you realize we're 40% earthworm and, no, sorry, 60% earthworm, and we're 40% fruit fly, and we're 98% mouse, because most of the genes in
And we're
our
80% banana, I think.
most of the genes in our genome are just designed to be allow us to be alive. We might call them housekeeping genes, but
Yeah.
there are only a few genes that make us actually, or a few variations in genes we call homologs that make us different. And so you can compare what you can to the intact elephant genome to what you're able to extract from fossils, and you can see that there are genes in those fossils, occasional genes that really aren't in the elephant genome. And so you have to conclude that, well, those must be genes specific to the mammoth because they were in mammoth fossils. And
Mm.
then you use CRISPR to inject those genes into the elephant. And I believe that Church is a genius and his people are going to come up with fascinating animals. But just understand what they're doing is recreating a mammoth-like elephant.
Crazy. It's fascinating stuff. And yeah, and you brought up CRISPR, which is a really important conversation. I want to talk about epigenetics for just a second, because even when you have the genome, it's not necessarily about the code, it's about how the code executes,
Right,
right?
exactly, right.
So, so that brings up a whole layer, a whole additional layer of complexity. But also, yeah, I guess I would focus on that first and foremost. How does that play in? And how, can we talk about perhaps the myth that comes with information that can be passed down through genetics, where they've done some research, some tests with mice, where they kind of train them to be scared of the smell of cherry blossoms, where every time they smell cherry blossoms, they electrocuted them, not executed them. And then their offsprings, when they smelt cherry blossoms, they started to panic, which indicated that information is passed on through genes. And that would explain perhaps some of the phobias we have of stuff that we've never encountered, like snakes or and whatnot. I've
Well,
never
I
really.
wouldn't go so far in that. I mean, it could be, but there isn't a lot of good work on the humans in this. But we do know that, that your DNA in all the cells of your body is the same. However, it can be suppressed, turned on, or turned off. And that's the only reason your heart muscle is different than your biceps muscle, and the only reason that your brain cells are different than your skin cells, because they all have the same genome, obviously, but certain genes are turned off or certain genes are turned on. And that's called epigenetics. And it's either with a methyl group on the DNA or it's a methyl group on the structure that the DNA surrounds itself with, the chromatin. And so there are two different ways that a methyl group, so to speak, uh, if it's attached to a particular gene, turns it off. So it's and so now the question that always comes up is, what about in your lifetime? Could there be changes related to alcohol intake, obesity, whatever, that might be turning off or turning on genes? Well, it so happens that in mice, studies continue to show that that can happen. We don't have any kind of piece of data in humans. However, those changes are normally erased during two phases of embryology development. Those epigenetic changes that occurred during life's experience are erased both in the gene in the germ cell, like the sperm or the egg, before it really develops, before it's fertilized. And there's a second erasure that occurs in that early embryo at the call it the stem cell stage. And those two stages of erasure gets it back to what it was before the epigenetic change. So a lot of research has to be done on that. But
So how do you reconcile those basic studies done with mice? Is there just flaws in the process of
We
how they
could
can?
be flaws in the process, we don't know. But there's good work in mice that shows that some of these epigenetic changes you described are transmitted to future generations. There's no
Which is
question
fascinating.
about it.
Yeah, I want to talk about CRISPR for just a moment because that was like one of the biggest breakthroughs in biology to date, comparable to what like the transistor was for the field of technology.
Yeah.
And we're only talking just a few years. I'm not really sure what the year was. Was it like 2012, 2013, where it was discovered? Pretty much, they hijacked the process of how bacteria and viruses kind of invade and store archived information from one another, where they can literally just go through genes, slice, add, do all sorts of stuff. How do you see this playing out, in terms of like, is it going to, it already is, I imagine, inviting a Cambrian explosion of innovation and engineering. And what do you see the future of this industry becoming?
Well, you're talking about the Cambrian explosion. So I thought you didn't know biology. I mean, that's pretty fantastic. Are you a biological, are you fascinated by biology?
Of course I am. I should be.
Obviously, yeah. I mean, you're really, I mean, I wouldn't talk to very many people that would understand that. Um, and it is an explosion usually. There's usually one mutation that leads to the possibility of sudden explosion of new mutations. Um, so I still want to hark back to why do eggs just they don't keep making themselves over again. You have all you're going to have, and they age. And two things happen as the woman gets older. One is the number of eggs goes down, and she doesn't make two eggs. And the second thing that happens is the eggs that she does have are aged, and they've been held, of course, in a rest, but they're aging and they're just not as fertile. And her fertility tends to drop off pretty dramatically by between ages 35 and 40. And then she's just struggling to be fertile. Maybe 10% of women are still fertile by age 40. By age 45, maybe 1 or 2% are fertile. And so the question is, what can we do for them? Well, there is one simple answer, and that is egg donation. Egg donation. In other
Okay.
words, you can get a younger woman anonymously, or if they want, she can be known, but it's usually anonymous, to donate her young eggs. They can be fertilized with her male partner's sperm, and it's a very simple thing. There's no real biotech miracle here. And then she is just as pregnant, just as likely to become pregnant as a 22-year-old would who's trying to get pregnant. You can just defy her, but it's not going to be her DNA. And then the question comes up is how important is DNA? Well, most people really want their own DNA transmitted into the next generation. So we work very hard with our technology to do it. Uh, but most women will stick with that. But if it absolutely doesn't work, most will be willing to go to donor eggs. And so, what's our experience with donor eggs since 1986? I tell every patient this. We can match for appearance and background easily. There are hundreds of thousands of young women out there that want to donate eggs. But what you can't match for are intangibles. And I can specify them: personality, character, intelligence, emotional stability, and bonding with you as mother. Those are the five things that really, really matter. It's an intangible about what who is the baby? How did Albert become Albert Einstein? What is it? I mean, how did Adolf become Adolf Hitler? To bring a terrible example up. Well, it appears that these intangible characteristics arise from all of the hundreds of thousands of events that occur every day in the early baby's life and its interaction with its environment, with its caregivers, with everybody else in the environment over the first 2 or 3 years. And uh, any any policeman working with serial killer problems that are trying to solve mysteries, first place they know it's almost always going to be a male because testosterone fuels it. However, they also know that it was a child who was beaten and treated with pedophilia and terrible experiences in the first early years of life. So, any rate, we don't have any unhappy cases in women that chose to use donor eggs, and it isn't their own DNA. And we've been doing that since 1986. When they can't get pregnant with their own eggs or they've run out of eggs, and women who chose to do it, and their families are very happy families. So that brings up the whole question of nature versus nurture. And I think that John Locke was correct when he wrote the philosophy that led to the American Revolution, actually. John Locke's political philosophy is that we're all just a blank sheet of paper when we're born.
On that note, I have a question for you, doctor.
That's controversial. And I brought that up because I think you would like controversy.
Yeah, I do. I do. It's like a perfect segue into a question that you just popped in my head. What's your perspective on the perhaps illusion of free will? So, are you a deterministic person? Do you believe that, like you mentioned, that we're our genetics plus our experiences, or is there something greater that allows us to have real choice?
Free will is a gigantic question philosophically. I mean, it only makes sense that uh, all of the different events that have surrounded us result in who we are. But what is autonomy? The other thing I'm sure that we are programmed for genetically, I'm just sure of this, is the need for autonomy. Take away autonomy of a baby, and you'll make that kid miserable. It's that's the origin of most mental illness. Destroy the autonomy.
Mm,
So when a baby is just 6 months and is starting to crawl, that's when you want to baby-proof the house. But you're not baby-proofing the house to protect your delicate knickknacks. You're baby-proofing the house so you don't have to say no, no. So that that child knows that there are limits and it can't go
mm,
beyond the walls and whatever limits you've set up, but they are natural limits of his or her environment. They're not imposed as no-nos. You can't do this. No, no, you can't do that. They reach natural limits knowing that they just can't do everything. They have to learn that there are limits in their life. But if you try to program like them, like a computer, do this, don't do that, it'll be a very unsuccessful effort.
yeah. So, one last question, doctor. On to the bigger picture here. What do you see the future like for uh for the industry of IVF, and is the conversation of menopause one that could be postponed for years and decades? Is this something like a biological clock that we can tinker with?
Okay. That's my pet project. We
Yeah,
can take
yeah.
out an ovary. We do this with cancer patients since 1997, but we can do that with anybody and take out one ovary. The other ovary, as the ovarian reserve goes down, the rate of follicle recruitment goes down. And so instead of menopause being at age 51, menopause will be at around age 49.5 if you take out an ovary. You don't reduce a woman's infertility. But then take advantage of that. And when she's 49 and goes through menopause, you take a little piece of that ovary tissue and put it back. And it lasts 10 or 12 years. And then
Oh,
she's 62. And then you take another little piece of that ovarian tissue that you've frozen, you put it back. And that's going to last really long because it's a smaller ovarian reserve. So the rate of follicle recruitment is less. So you can allow women to have
but is the quality of the resulting egg weaker?
no, not at all. It's still a 20-year-old ovary, even though she's 70 years old. and she never has to go through menopause because you can put a little piece of tissue under her arm skin every 10 years after age 50, and she doesn't have to go on hormone replacement pills or shots or patches. All she has to do is just live a normal life, and she may not want to have periods anymore, but you can stop them by putting in a Mirena IUD. And so this is one of my pet procedures. We can freeze the old
Fascinating.
tissue and keep her fertile until she's 100 and prevent menopause until she's 100.
So
But you
extrapolating outwards on that,
okay.
what how would you view that within the lens of longevity and living longer? I mean, you're
Well,
tinkling with a fundamental barrier of aging and passing on genes. I mean, can that concept or that way of thinking be brought in for
well,
more underlying issues?
one thing is for sure. We know that menopause is a disease, and women should not be allowed to be hormone deficient. And we've studied this in rats and mice even. If you take out both ovaries in rats and mice that are identical, genetically, because we have strains like that, the ones who lost their ovary will definitely die much earlier.
Mm,
Really need the hormones. And so hormone replacement therapy is finally becoming more popular because the truly good scientific studies show that it's not only not harmful, but it's very important for a woman's health. But much better are her own hormones rather than the synthetic ones we can give her. And so it sounds radical, but we've done this for cancer patients because they have no choice. I mean, it's not an ethical issue. You take out an ovary, you freeze it for their future, and then they become sterile. And
right.
then you put the ovary tissue back after they've been cured. And we know from those cases that we can keep them functioning for many decades, theoretically
Wow.
until they're 100 years old, with that putting back a little bit of ovary tissue at a time that you froze when they were young.
Fascinating stuff, doctor. How can people get in touch with you?
Well,
Are you,
you can
are you,
just go to the website infertile.com, or you can just put my name there and it'll go to my website, Sherman Silber. .com or infertile.com, and it's really easy to find us, and I'm happy. You can tell that I enjoy talking, so I'm happy to talk to any
I
patient.
was gonna say I appreciate you giving me more time than you promised. So I thank you very much.
It's fun talking with you. I really love discursive conversations and not
Me
just,
too.
yeah,
Me too.
absolutely.